Dr Teh from Plantmed. He lives in my valley just up the road. I'm really looking forward to hearing from him. I want to listen to this, and thrilled you're here today. Where is he? Thrilled he's coming, because he's one of a batch of new doctors who have embraced cannabis and, you know, being able to help people get it legally. So I heard bits of Dr Deb sound like she was pretty savage, but I know that he's a good man. This, so thrilled you're here, Doc. Thanks very much.
Thank you. Good morning, everyone, and thanks to Michael and the whole Medican team for putting this on. It's great to see so many people interested in medicinal cannabis. So I suppose first a bit of background. I am your standard medical doctor. I graduated in Brisbane at the University of Queensland. For many years I've been in the surgery field. But since 2016 my mind's been changed a lot. And that all started with a young girl called Nikki. So she was a beautiful friend of mine and became a patient.
It's on.
Yep. Oh, thank you. And she became a patient, and that was just before any of this medical legalisation was talked about, and she had a very bad brain tumour. So she came to me and said, what can I do about this? And I said, well, you know, I've been doing a lot of reading on medicinal cannabis. There's a place down the road you could probably go. And this is before anything was legal, and I saw her whole journey with medicinal cannabis. Not being able to access medicinal cannabis throughout the whole time of her disease journey. And she had great results. We extended her life. She enjoyed that last portion of her life, but unfortunately she did pass away. So that made me think, well, actually, no, this isn't fair. That's not fair. This 21-year-old girl died. It's not fair. And then it so turned out that medicinal cannabis came onto the horizon. So I started consulting people as soon as I was able to, back in the end of 2016. And since then I've seen over 500 patients now. And I've opened up this medical cannabis clinic in Brisbane at Eagle Farm. And I see patients every day. I'm a full-time cannabis doctor now. And I do... Thank you. And I do navigate the treacherous bureaucratic landscape that is our governmental system. But it is a system, and we do have it. And it started out in paper, and it would take me 2 or 3 hours to get an application through. Now it's online, and I can get those applications through in about half an hour, 20 minutes, if I'm on my game that day. So I see a lot of patients. Next slide, please, sister. I see a lot of patients every day, and this is the plant which we use to help them. Cannabis sativa, cannabis indica, cannabis ruderalis, they're all cannabis. And they contain 2 major components. Next slide, please, sister. CBD and THC. And I'm not going to take up our time today talking about how these things actually work. I think a lot of you here would have done the doctor's Google. You'll have known that there's 2 main components in the cannabis, and that's why we take it. CBD is a very excellent molecule. It supports THC. It helps it last longer in our blood. It smooths out that psychoactive effect so we can increase our THC doses. It's anti-inflammatory, and it works in reducing inflammation and the overt immune responses we get in a lot of inflammatory diseases today. Ulcerative colitis is one of those. Next slide, please, sister. So you can see we have a lot of pictures of plants here, and there's a reason for that. That's exactly where your medicine comes from when you take medicinal cannabis.
I hope your medicines are as potent as that.
Unfortunately, they have been slightly diluted by the time we get them through the legal framework, and it is a bit of work for me and my team at Plantmed, but we do our best to navigate that framework. And the door's open for medicinal cannabis, and every day I see more and more patients. And what do I see them for? Next slide, please, sister. I see them for chronic pain. Chronic pain is definitely one of the main things that I see patients for. pain from rheumatoid arthritis, pain from fibromyalgia, pain from motor vehicle accidents or motorcycle accidents they've had years ago. And I definitely do use THC in those patients, and I definitely do use CBD in those patients, and I get amazing results. Generally, people get a result with medicinal cannabis. Generally, we can reduce the use of other pharmaceutical drugs with medicinal cannabis. And I start very softly with my patients because 99% of the patients that I see don't know what cannabis is really. They've never tried cannabis. They've only seen it on Channel 7 News. And there's a lot of fear there about the psychoactive effect. Oh no, I'm going to get a psychoactive effect. Well, that psychoactive effect is actually part of the medicine. It makes people feel better about themselves, about their depression. It helps remove their pain. And when you remove someone's pain, that's better than any sort of high you can give that person. So I see that very often. I see a lot of inflammatory diseases. And how we approach the process of applying is actually kind of convoluted. It's kind of like the law that we were just talking about. We can't actually say, look, I want to treat this person with medicinal cannabis because they've got ulcerative colitis and I'm going to fix that. I won't get the approval through. I can get an approval through for that person saying, oh, this person's got ulcerative colitis. She's in a lot of pain. She's tried all these other drugs. They made her thinking fuzzy. They made her anemic. They could do many things. The side effects of these drugs were too much for that patient. But she's tried them, and then it's not a first-line treatment. And there's a funny little rule in Australia that I can't prescribe medicinal cannabis as a first-line treatment. So anyone can make an appointment to see me, and they can come in, and so long as they've tried some other medications for their pain before, so they've tried some conventional therapy, and that symptom is not relieved, then they're eligible for medicinal cannabis. So it's not just chronic pain, it's not just epilepsy, it's not just chemotherapy-induced nausea and vomiting, and it's not just multiple sclerosis. Anyone is eligible to access medicinal cannabis legally in Australia so long as they have tried a first-line treatment, not cannabis, it was unsuccessful, then they're eligible to get that application through. And I'm not treating to cure any of these diseases, I'm treating to help prevent the symptoms of those diseases, the pain, the nausea, whatever it may be, anorexia, insomnia, anxiety, depression. I'm not treating PTSD, I'm treating the anxiety of PTSD. I'm treating the night terrors of PTSD. It just so happens that when you treat someone with PTSD with medicinal cannabis, next slide please, sister, we're looking at the endocannabinoid system. Next slide please, sister. And we're looking about how these medicines interact with our body, and that is via, next slide please, sister, until we get to endocannabinoid system. It's how these molecules interact with our body. And the endocannabinoid system is a system which we all have in our bodies, and they're all unique in their level of functioning. But one thing they do is keep our body in homeostasis, keep all of our systems, our endocrine system, our sleep-wake cycles, our emotions and anxieties, our thoughts and memories, our pain perception, our inflammation, our immune response, everything in our body, our reproduction, our bone growth, everything. And the endocannabinoid sits on top of all of it, and whenever we have a stress that pushes any of these systems out of their balance point, the endocannabinoid system kicks in. And it kicks in to bring down the temperature. It kicks in to reduce the inflammation. It kicks in to relieve the aversive memories. And these cannabis receptors are situated throughout our body. Next slide, please, sister. Cannabis receptors there's many of them, but there's two main ones we look at, cannabis 1 and cannabis 2. And in our body we have the ability to produce our own cannabis, our own endogenous internal cannabinoids, our own body's cannabinoids. And we secrete those in response to the stress I mentioned. The two types of receptors, CB1, situated centrally in the brain and spinal column, associated with all of the functioning and the deeper functioning of our brain. These receptors are especially concentrated in the areas deep in our brain, so emotion, hunger, fight and flight, memory, how we feel. And they're also prominent in the top part of our brain, our cerebral hemispheres. The bits of our brain which I'm using right now to talk to you, the bit of our brain which deals with logic, which deals with facts, which deals with things that we've experienced. And what happens in PTSD is, or any aversive trauma, is the memory of that event causes physiological response in your body. So when you remember that car accident, or that time you're at war, or that bad abusive relationship, your heart starts to race and your breathing gets faster. And that's an autonomic response, okay? So that's what PTSD is. Most people have a bad thing happen to them, they can deal with it and they remember it, but their heart doesn't race. They don't feel like they've got to run away again. Cannabis changes that somehow. It's called fear extinction or memory extinction. And that's why we use cannabis for PTSD. And we don't know exactly how it works, but somehow we know there's a lot of receptors there and we know these molecules are going there, and somehow it changes the relationship between the thought part of our mind and the inside part of our mind, and allows us to adjust to that, and we don't get the racy heart anymore and we just remember it and that's all gone and we're relaxed. So that's one use of our cannabis medicine. I could talk about that sort of thing all day, but I won't. And I'm going to open up the floor to questions, but I've got a few more things I want to mention first. I get a lot of compassionate or green market clients in my clinic, as well as the straight THCA applications, which I do as the bulk of my work. But there is definitely a proportion of green market or compassionate clients which I see. And essentially, you know, whether you get your medicine from here, whether you grow your medicine, whether you make it, whether you buy it from the government-approved sources, so long as it's clean, preferably organic grown, but so long as it's clean, we know roughly or exactly what the constitution of that is, so how much THC, how much CBD. And we know how we're using it, then it becomes a medicine. So we're using these molecules for a reason, to make us feel better. And we have to have a plan for that, and that's cannabis medicine. We have a plan of how we're going to use the cannabis to relieve our symptoms, and we take it regularly, and regularity is part of medicine too. Regularity, the same way that if you've had a heart attack, your doctor says to you, have half an aspirin every day, and you're like, it doesn't even do anything, but it does, it thins your blood out so you don't have another heart attack. Well, if you've got an educated cannabis doctor, he might say, have 5 milligrams of THC every evening, or have 20. And that's their decision, and for you to work with them together, because cannabis medicine is a very personalised medicine. So yeah, cannabis medicine is a real thing, and I'm very happy to be part of it in Australia. Happy to be able to talk to people and bring some education. And I cop a lot of negative responses, negative attitudes from people in my industry, the medical industry. And that's okay, I've got a thick skin, I don't mind that. And I can talk about it because I know that I'm standing in my truth and I'm talking within the law and everything I'm doing is fine. And I'm helping people, and I see that every day. I'm helping people, and I know that. And that's what makes me come back and do this over and over again. Cost. Yes, very expensive at the moment. Very expensive to go through our clinic and access, next slide please sister, to access medicinal cannabis through the pathways, next slide please sister, of the THCA. But it's easy to do when you know what you're doing, and it's the majority of these people in this room, I'm sure we'd be able to get that approval through. But it is more expensive when you're taking these sources at the moment. That does put people off. So no matter where you get your medicine, so long as it's clean, so long as you know what you're doing and have a plan for that medicine, yes, cannabis medicine is amazing. And there are some side effects, but they're minor. And they're all dose related. And when you're taking cannabis under my medical care or supervision, I ensure that that titration is smooth. I ensure that not everyone here is a smoker. Not everyone has smoked since birth or since they were a teenager or smoked at all. So I'm very wary of easing people into this medicine because it is a powerful medicine, and used wrongly it can cause confusion and cause problems. But generally, it's all very good. Next slide, please, sister. So that was just talking about the cannabis receptors we were talking about before. So I normally give lectures, next slide please sister, on how it works, on how we medicate. And this is a picture of radio-labelled cannabinoids connecting into receptors in our body. So you can see there's a lot in the brain, there's a lot in the liver there, and in the reproductive organs, and all centrally. They're everywhere, and peripherally with the lymph nodes. Importantly, CBD, it brings me back to CBD, reacts with our CB2 receptors in a way that makes their little fingers stronger. So when we take CBD, it holds on tighter to our endogenous cannabinoids, anandamide and 2-AG, the ones we make, and they have a better effect. And CBD helps hold on to the THC we put into our bodies and have a better effect as well. Next slide, please, sister. Next slide, please. Whole plant medicine. You've heard this from everyone, and so you should. It's very important. Now, there's companies making isolates. Definitely, you can have 100% isolated THC, 100% isolated CBD, just one molecule in solution, diluted down with whatever oil. But when we've done studies on this, we've found that to get the same effect for the milligrams of CBD, you need to take 4 to 5 times the amount of milligrams of isolated CBD to get a worse effect than 1/5 of that of a whole plant medicine. And why is that? Because in this plant, and there's many chemovars and varieties available, and that's part of my job as a cannabis doctor, to help select your ratios of cannabinoids and terpenes. Not everyone can know all about that stuff, so that's why you do need someone that's read about it and thought, I know what these terpenes and these cannabinoids do, and we select the correct strains for you. But whole plant medicine, inside the plant there's not just THC and CBD, there's cannabigerol, cannabichromene, there's 144 plus different cannabinoids which have been so far discovered. There's over 400 different terpenes which have so far been discovered in the cannabis plant. And an interesting fact is, terpenes, sorry for people that don't know, are the aromatic things in flowers and fruits and in cannabis that give it that beautiful smell. And the cannabis plant can actually contain any terpene of any other plant on our planet. So the cannabis plant can have linalool, which is normally found in lavender. It can have myrcene, which is normally found in mangoes. It can have beta-caryophyllene, which is found in copaiba oil or black pepper. And all of this mixed, the way that nature's made this plant, when grown with respect, and as we had mentioned before, not pushed with hydroponic techniques, but grown with respect, we get a ratio of medicines that is specific to the plant. So in fact, there's not one type of cannabis medicine, there's hundreds of thousands of types of cannabis medicine. They're all subtypes of the same thing, and they're all specific to each person. Yes?
Can I just ask a random question?
Yes.
When you're talking about whole plant medicine, can you explain the difference between a CBD isolate and a whole plant CBD medicine for us?
Definitely.
Did everyone hear that question?
So the question was, can you explain the difference between a CBD isolate and a whole plant CBD medicine? So a CBD isolate is where we get the plant, they take the vegetative matter out of it and they extract only the CBD molecule out. And then they'll put that into solution with some other oil or some alcohol, and that's your medicine. And that may be 18% or 20% or whatever it is. Then if you were to get a whole plant medicine, you would take that plant and you would extract all of those active compounds, all the cannabinoids, all the terpenes, all the flavonoids. You throw away the plant stuff because that's just fibre, and all of those active molecules then go into the medicine. So you may still only have an 18% CBD medicine, or you might have a less than 18% CBD medicine, but it'll be more effective and stronger than just the CBD alone. So it seems that when we remove them in isolation, we get a weaker effect. And that brings me to another thing that patients ask a lot as well is, what's the difference? They say, oh, I've got some hemp oil from the health food store and it's got some turmeric and some black pepper in it, and oh, it's great, I'm having 3 drops a night. Unfortunately, that's probably hemp seed oil, which contains absolutely no cannabinoids. You know, and there's a lot of confusion. What's hemp around hemp and hemp seed oil, and what is cannabis medicine? So we have to be careful exactly where you source your medicine from. That's the beauty of the THCA and the legal system, is that I actually do know exactly what terpenes and cannabinoids are in those medicines I'm prescribing. I actually do know down to the exact milligram per milliliter when you draw it up in your little syringe how many cannabinoids you're getting in that medicine. And I do know that they've passed strict quality controls for impurities such as fungus, herbicides, fungicides, excess nutrients, that they've been flushed well before their medicine's made. So that is the upside of the legal side of the medicinal cannabis industry, yes.
Would it be good if you got a certain type of plant, specific strain, and then juiced the whole plant, juiced the well-being?
100% yes. So that will be, you'll be using what's called you'll be accessing
Just repeat that back so everyone can hear.
Oh yeah, so the question was, would it be good if I got a specific strain of cannabis and then juiced the whole thing and ate it? And my answer to that is yes. And what you're doing there is you're getting your cannabinoids in acidic form, THCA and CBDA. That means that no heat's been applied to these molecules. That means that the THC in particular can't fit into your cannabis receptors in your body because it's got this little A off the side, it doesn't fit in the lock. When we heat them, that's called decarboxylation. When we heat cannabis, that's when it becomes active in terms of psychoactive effect. But yes, to answer that, you'll be getting the best source of THCA and all of your raw acidic form cannabinoids, and all of your terpenes will be in their full quota. So sometimes when we extract using different types of methods, we lose some of the terpenes. And that's exactly what Morgan did for ulcerative colitis. So essentially by juicing that medicine, she's been accessing the raw health benefits of cannabis.
And that's all organic and you go through the whole cycle?
That's right, yeah. That's a very good thing to do, should you have that opportunity. Yes?
If you're drinking the THCA, that's still drug show up in the drug test?
I think, yes, it will.
The question being, does THCA show up in a drug test?
So yeah, when it goes through your body, it goes through your liver, it gets metabolised at different levels, and I think, I'm not 100% certain on the chemistry of that, but I'm pretty sure that it could show up. Yes.
So by going through that process, that organic, doing the whole plant thing, it could still come up if you got pulled over?
I would say yes. Yes, I would say
Does
yes.
the THC go on a type of plant or have THC in it?
Any sort of ratio, I even say to my patients when I prescribe whole plant CBDs, technically this could show up because there is some THC. It may be less than 1% in there, but it still could show up. In terms of driving and drug testing and the way that the police do it is they scrape your tongue and they look for these things, that's a relevant question. So when they look for that, looking for THC in the cells of your mouth, so it goes on time from when you've had it, so 2 hours later you're probably in trouble. 4 hours, 8 hours later, it gets less and less. So, and whether you brush your teeth and brush your tongue is another little thing as well. Yes, up the back.
Sorry, can't hear you, sir.
Just speak up a little bit, please.
Sorry.
For ulcerative colitis,
It was
in particular.
What was the question?
The question was, what does CBD oil do for ulcerative colitis? It's a good question. So CBD has its effects by binding to the side of the cannabis receptor and causing them to hold on to cannabis THC molecules and endocannabinoids and anandamide and 2-AG stronger and for longer. CBD reduces the rate of degradation of our body's own endogenous cannabinoids once they've been generated and left in the synapse. so therefore increasing the duration of action of our own endocannabinoids. And in particular for ulcerative colitis, CBD activates or works upon the cannabis 2 receptors, which are associated with all of our inflammatory cells, all of our lymph nodes, all of our white blood cells, our bone marrow, our spleen. And in the case of ulcerative colitis, there's a chain of lymph nodes that go along the bowel. And there's a reason for this, because the bowel is the interface between us and the outside world. And this is our little defence network. So in the particular case of ulcerative colitis, the CBD will come and bind to those receptors in particular, because whenever our endocannabinoid system is stimulated, whenever there's a problem or a stress, generally those cells will exude cannabis receptors and have more concentration, therefore attracting the attention of our own endocannabinoids and THC. So that's how it works as a medicine. So that's why it's a multimodal medicine. We can look at multiple systems. We can fix 2 systems at once with cannabis, because they'll sort of gravitate to where the receptors are being expressed. So in this particular case, ulcerative colitis gains its benefit by reducing the overt excessive inflammatory response that causes the mucosal irritation, ulceration and sloughing off and damage. So for whatever reason with ulcerative colitis, we're getting an excessive inflammatory response on these sensitive gut cells, and that's reduced with CBD.
Dr. Teh, can I ask you a quick question?
Yes.
Specific to... So Dr. Teh is the first person we've ever had here over the years who actually runs a medical cannabis clinic. So the questions should be valuable if we target that.
Yes.
And one of the questions... I've got 2 questions for you. Very briefly. On the THCA website, you can offer... They offer whole plant buds. So
That's correct.
is there a situation, this is my first question, where a client could be prescribed a whole plant bud? My next question to you is, in the old medical system, people were labelled as cannabis addicts. So do you have a problem prescribing to someone who has been prescribed or labelled as being a cannabis user or addict?
Okay, so the first question in regards to whole buds as medicine, yes, they're available to prescribe, and they're at the discretion of the doctor whether they're useful. And I generally start with oils for my patients, because generally you can get a handle on things with oils. Things like sometimes...
What if I came to see you then? I said,
if you came to see me and I take a history of what your smoking history is. I say, how many cones a day do you have? What do you do?
I'm classified as a cannabis addict.
So I'll go with that question first. There is no such thing as a cannabis addict.
But it says in my medical notes, the doctor wrote that.
But that's not a real term. So in fact, cannabis is not addictive. I mean, and it may be historically correct, but there's no cannabis addict. So I treat patients that do smoke, self-medicating essentially. They may be smoking quite a lot. So in that sense, there's no such thing, and it doesn't preclude anyone from accessing cannabis. The fact to me that you are self-medicating for whatever your reasons is a reason to prescribe, because it's obviously working for you. So that's why I will do it. And I generally start with oils, but then I do prescribe flower or bud.
Okay.
In situations where, for instance, your situation, you're used to it, you know that medicine works for you, so I'll use it. Other situations could be insomnia, or where the nighttime dose of the THC is too high. We get pain relief, but you wake up hungover the next day. In that situation, I'll prescribe a cannabis bud to be smoked in the evening prior to bed, so that we don't have too much THC level in the blood, so that when you wake up the next morning, you're okay. Because when you inhale vaporized cannabis, and you can't smoke legally cannabis as a medicine, you can vaporize. When you inhale cannabis, you get a very quick high blood level peak. At about 2 hours, you'll get a peak. It comes on straight away within 15 minutes, and then drops off and's gone by 4 hours. So often that's enough to get people to sleep. And then if they take at the same time an oral indica, and I never really prescribe THC without CBD, so it'll be oral indica and some form of CBD to assist their pain relief and sleep overnight, we can lower that oral dose so that when they wake up in the morning, they're fresh. So there's an example of how I would use that.
And what sort of costs would I be expected to pay?
Approximately 4 times what you would find in the green market is 3 to 4 times. So you'll be looking at, for 10 grams of high quality cannabis bud, in the region of $250. So quite expensive. Yeah, quite expensive, but that's there, that is available. And for instance, I have someone similar to you, an experienced self-medicator for pain, who I prescribed them in the region of 35 grams per month, because that's what they were using. They were from Israel originally, and they had their medical cannabis license from Israel, and that's what they've been doing for 10 years. So they've come to Australia and they wanted to access through this legal system. So I used their medical history, which in this case was a cannabis history as well, to judge my dosing of that patient.
Where does the medicinal cannabis come from?
The medicinal cannabis that we can access in Australia at the moment, there's one supplier in Western Australia. I won't say any names, but there's one supplier over there that is producing Australian-grown cannabis. There's one up the Sunshine Coast that has about to release their first crop of cannabis in oil and flower form. The rest is imported, mainly from Canada, where it's medically and recreationally legal. So cannabis can be technically imported to Australia from any jurisdiction where it's medically legal. Yes?
Thank you. So I just want to be careful because what I'm going to say is not legal advice, and this is strictly related to turning up with the saliva test, not
Yes, yes.
urine or blood, okay? But what do you say to one of the police experts in one of the cases I talked about said that if cannabis was ingested either by suppository or in capsule form, it wouldn't turn up in an oral fluid sample with THC. It wouldn't turn up in an oral fluid sample because it would turn up in fat and it's fat absorbed. Do you have any take on that? Because I just found an odd thing for the police expert to say that effectively the legislature's saying, oh, it comes down to method of how you
Method
test
of
it.
use.
It's both already screwed, but if you suppository or
Capsule.
cap.
I think depending on your duration of use and your baseline level of THC, I think you could potentially get some in your saliva, but the concentration which will be tested for is literally from those saliva and the cells in your mouth. So if you're using an oil or you're smoking or vaporizing and it's going past those mucous membranes, it's going to be absorbed there. So if you were to have a capsule or suppository, the chances, I don't think it'd completely rule out your positive test, but your chances of being positively tested on the initial saliva scrape would be greatly reduced. And I'm not sure of the supporting evidence of these things, but some people will swear by apple cider vinegar in the door of their car, or fishermen's friends I've heard as well. But one that I do think would be very beneficial, besides brushing your teeth obviously and your tongue, in terms of not responding positively in a test, would be a spoon of coconut oil or some sort of fat held in your mouth for a minute or two, swished around and then swallowed. And effectively, because THC is fat soluble, it would be diffused into that oil and then removed once again slightly more. So you may still test positive, but it would reduce the chances of that, I think. And the purple at the back? Is the endocannabinoid system taught at med school? No.
The opioid system is.
The opioid system is taught, but cannabis medicine has never been taught. I'm an educator in cannabis medicine for doctors and GPs, and actually I'll give myself a plug now, the AustralianCannabisSummit.com. AustralianCannabisSummit.com. It's free to register. It's an educational forum. I've gathered all the best people in Australia that know about medicinal cannabis and all the best doctors that I could contact internationally. So we've got world-leading doctors giving their knowledge on medicinal cannabis, and it's free. So just put your email down there and register, and that's on the 5th and 6th of July. Yes. AustralianCannabisSummit.com. cannabis.com. It's on the last slide, actually.
Yeah.
It's online. It's being held. We're running it from Plantmed, my clinic in Brisbane. So we're transmitting it from there. It's going to be transmitted live. We've got interviews and all sorts of panels and things. But then it's really an internet-based thing, so you can watch it from the comfort of your own home, and it goes over 2 days. And then it'll be up for a few months after that, so everyone can digest that info.
I'll show it on the slides.
It's on the last slide, so Sister will put that up. Yes, over here.
If you're treating someone that's got cancer, say pancreatic cancer or tumours, are they only treating for things like nausea and pain, or are they already starting to treat for reduction of tumour size?
That's a very good question. So the question was, what are we treating cancer patients for in the legal framework, essentially? Something like pancreatic cancer, say. Technically, I'm treating for relief of the symptoms of nausea, of pain, of anxiety that goes along with cancer, or palliative cases. So if you're expected to die within a year, then you're palliative. We can treat for that. We can't treat to cure the cancer. There is no cure for cancer, but there's many things that I would recommend to a cancer patient in terms of diet, supplementation, maximising their endocannabinoid system, and of course cannabis medicines. But generally the dosing for curative treatment of cancer, which is all based on overseas really, where a lot of it happens, especially California and the States, Canada, you're looking at dosing levels in the region of 150 or so, 200 to 350 or even 500 milligrams of mixed cannabinoids. So that means CBD and THC. So you're looking at levels of 100 to 200 milligrams of THC per day. So it's quite a lot. It's quite strong. And when we're treating for cancer, you have to explain that to patients. And the only real way that patients can treat for cancer in Australia is through the green market. But the same rules apply. You know, it's the same molecules in that medicine. You can maximise dosing within the THCA framework for the symptom relief, and cannabis treatment for cancer is to tolerance. So tolerance may be 30 milligrams for someone, it may be 400 milligrams, and in children it may be 1,000 milligrams a day. So what the person can tolerate. So sometimes you can treat within the THCA framework people palliative or for cancer or for symptom relief, and whenever you're taking cannabinoids, you're benefiting your endocannabinoid system, you're benefiting your body and your immune system, and you're assisting it to do the work to beat cancer. So it's never the medicine that kills the cancer, it's your own body which reacts in the appropriate ways to break those cells down.
Is that because it's in a relaxed state, your body? Once you're taking the oil, your body becomes relaxed, so it's able to fight whatever disease is.
It's not really relaxation. I suppose relaxation is a side effect of all the things. It's the molecules and the interaction between those molecules and your body's endocannabinoid system, and the way that it stimulates your immune system to function appropriately. Up the back there.
I'm just wondering whether the colleges of physicians, GPs and the rest of you have any pushback towards changing the legislation around the driving stuff that's happening in New South Wales, Queensland and Victoria, because let's face it, judges and medicos and legislators.
So the question was, do the colleges of doctors in Australia have anything to say about driving and cannabis? And in fact, there's no official statement from any of those bodies, because there's no official statement on cannabis from any of those bodies. The Royal College of GPs does have some sort of guidelines and sees it as a medicine, but that's really a political question. There are studies being done at the moment by the Lambert Initiative down in Sydney, getting people high, testing their reflexes on high quality driving simulators, seeing how many crashes they have, seeing what level of impairment, and as Michael said before, rather than presence, we need to be testing for impairment. So that's something which I always tell my patients about, but really it's not something I use in my clinical judgment, because it's nothing to do with medicine. It's laws and rules, and the rules are outside of clinical therapeutic effect. So I have to tell people about the rules, but that doesn't change the way I would prefer to treat them. it does often change how we end up treating, because someone may be not willing to take that sort of risk of driving. They just say, I can't do that. Or some people will just not drive, or some people will drive and don't tell me about it, and that's their choice. But yes, so there's no official statement to that. There's no organised strategy, no.
Can I ask about osteoporosis? Does it affect them on osteoporosis?
But potentially, cannabis is effective for osteoporosis, and there's a few studies out there showing the benefits of especially CBD. What happens is there's stimulation of I think it's actually suppression of the cells that resorb your bone, osteoclasts, so they prevent further breakdown of bone. Yes, CBD, yes.
Sorry, I think we could conclude that cannabis is actually good for every condition. So we don't have to go through every condition through the audience questions, so to speak. But one question is there a difference in running these clinics by the different state legislations? Because you're from Queensland and we're in New South Wales. And secondly, have you ever heard of the endocannabinoid deficiency syndrome? And
Yes.
got people on it for that or what?
Yes. So yeah, in terms of the legalities state to state, Plantmed, we're based in Brisbane, Queensland obviously, and we treat everywhere in Australia except Tasmania and Western Australia, because they won't accept my prescriptions, but the rest of Australia, interstate is fine. We do telemed, video medicine for those sort of people that are interstate, and it's totally legal interstate. Okay. The second question was, what is the endocannabinoid deficiency syndrome, and is that relevant in my practice? And the answer to that is yes, it is relevant. The endocannabinoid deficiency syndrome is not a disease as such. I talk about it in terms of endocannabinoid tone. So when you're young and you're healthy and you're born and you're fresh, your endocannabinoid system is right up here. It's doing its job. It's going great. Over time, aging, pollution, pharmaceutical medications, environmental toxins, Roundup, herbicides, it gets broken down, and aging, just life, it's like any system. It loses its capacity to function as well as it can, and at some point it's going to drop below the symptom line, and that's when you're going to start to get symptoms that are associated with this. There's a group of diseases which is associated with this. It's migraines, fibromyalgia, rheumatoid arthritis, basically inflammatory diseases and diseases of the modern world. And the body's unable to keep up its stress relief through the endocannabinoid system, so we end up with pain, we end up all the symptoms of those diseases. So it's not something which I prescribe specifically for, but it's something that you are actually treating when you're dealing with someone's symptoms of pain. So yeah, it's very common, and I have lots of pain, migraine patients, and endometriosis is another one in that group. So when they come in my mind, I go, ding, ding, endocannabinoid deficiency syndrome. Let's boost up the endocannabinoid system. Let's boost up with cannabinoids.
We should put that
Yes.
final slide. I want it.
No. Sorry, just before you answer. Sorry, just 2 seconds before you answer.
Yeah, just flick through. There's just pictures of mainly buds till the end.
Show
Yeah,
the
just
summit.
So I'm going to
Yes.
flick through the slides, and we're
the
going to
summit.
show the summit at the
Yeah.
end, and
Yeah.
we're slowly winding up, but
Yeah.
we'll just go back to that question, please.
It's an interesting situation. I can see, he's a great talker. Isn't it great having him here? And I can see how it'd be great for him to stay on for another hour or two. So let me tell you the situation. There's good food down there, but it'll end up being a long queue. So anyone who wants to go and get in early should go down there now, and we could let you keep talking for a little bit.
I
Is that okay?
can take some questions from people, because
Yeah.
I know I'll just get questions outside, and,
Yeah,
and then
so-
sometimes we can double up on those questions.
But some of you, I reckon, should go and order food now. If you do want to get lunch, it'll take a while. And then we'll have a break, and there's demonstrations out there of extractions and different people you can talk to. But it's great to let your questions keep going.
No
Is that
problem.
okay?
That's fine, that's
Good on
fine.
you.
So that question was in regards to topical. So the amount of absorption topically will be very a lot smaller. If you're using a THC-containing compound, they will get through your skin, but only at much lower levels, and they actually act more within that skin layers as such. So the chances of getting saliva tested on that sort of topical application will be very, very small, but possible. Yes. Yep.
How do we go about accessing you? Do we need a referral from the GP?
Oh yes, I should cover that. So yeah, this is the Australian Cannabis Summit here, australiancannabissummit.com. To access the legal pathway, we do need a referral from your GP or specialist, and then you just simply ring us up or contact us at plantmed.net.au, and there's some flyers outside, plantmed.net.au, and that's it. A referral from your GP and a good history from them was also very useful. I'll need a list of your failed medications, a list of your current medications, and the fact that I have to elicit the fact that your symptoms haven't been relieved, then I can go ahead with that process. So that's the way. But yeah, GP referral is required. It's just part of the rules.
What about private health?
Private health doesn't generally pay for any of it. My fees are out of pocket because I'm not actually a general practitioner. So that $38 you can't get back on Medicare. Yeah, so that's all you need. A GP referral, a specialist referral, and away we go. Yes, up the back, in the back corner.
I just want to say thank you for doing what you're doing.
No problem. It's a pleasure.
My question, I'm just interested to hear how you would like to see cannabis legislation addressed in Australia. Do you have concerns about it being legalised recreationally before we have that education?
I'm not concerned about that. It's something I definitely take into consideration. I think medicinal cannabis and recreational cannabis markets are completely different, and that's been evidenced overseas. So I welcome a recreational market in Australia, and I welcome further progress in our medicinal market. I think that there's a lot of differences there, and I could talk for a long time about it, but I think when you're trying to treat disease, it's good to have someone on your side that can help you pick out the correct strains, to pick out the correct dosages, give you the right regime and the right ratios. And we can all Dr. Google it, but there is so much information out there that you become lost, it becomes overwhelming. So I think there's always going to be a strong position for medicinal cannabis in Australia, and I welcome recreational cannabis to be brought in as well. So hopefully both of those things can accelerate. Yes, over with the colourful jumper.
Starting the oil, does that instantly work as taking away versus pain?
So that's a very good question. Does starting cannabis oils instantly take away your pain? And you can get that effect as we see on the internet. We can see those magic effects. But generally I find the answer to that question is no. And I like to titrate very slowly patients' medicines up. There is the cumulative effect of THC being held in your body in the fat cells, and there's the cumulative effect of the ongoing support of your endocannabinoid system. So all of these things add up together to help bring pain reduction, reduced inflammation plus THC. Probably, of course, if you took a really, really large dose of THC in one go and you'd never taken any THC before, it will get rid of your pain, but it might give you extreme paranoia. So you have to be careful about introduction of the medicine. And I find, as I say, 99% of my patients are cannabis naive or have never smoked cannabis before. And so I'm very careful about that smooth introduction to avoid any of the side effects. And yeah, there are a few minor side effects, and they're mainly emotional, how you feel. Anxiety is a big one. Yes? I think probably yes, there's an element of that because it hasn't got, your skin hasn't got a really massive high blood flow until you get deeper down into it. So I've got a great slide showing all this, and it's a cross-section of the layer of all the skin cells and the hair coming out, and there's lots of little receptors in each different layer, different cannabinoid receptors. So there's CB2 receptors, a lot of them there. There's TRPV1 receptors. So over time, I would imagine because you'd be using some sort of fat-based oil, it would be accumulating in that localized region. So when you reapply, it's sort of topping up and diffusing through that oil that's already there. So I can imagine that would be an explanation for that. In the back?
I was just wondering, we started studying, and it works quite significantly in integrated medication, but as you do it up,
Yeah, so when I was studying, it wasn't, I graduated back in 1999. So cannabis was completely illegal. It wasn't considered a medicine, it was considered a narcotic. There was no talk of cannabis at the university, so there was nothing to push against in that sense. I just self-taught myself through the internet, essentially initially, and then going to lots of conferences and talking to people that are doing it. And that really started probably, well, over the last 8 or 10 years for myself, and became solidified in the end of 2016 when cannabis became legalised for medicinal use in Australia. So then I could move forward with that and act upon it. So there's no education, there was nothing to rebel against at university. It still is, and doctors' level of knowledge in Australia is very low, as our first speaker was saying today. And they'll often just say no to people, or we've had people rip up our referral pads and throw them in the bin in front of the patient and say, don't you know cannabis is illegal and it will harm your child? Ridiculous things, and they're blatantly wrong. And cannabis is medicinally legalised in Australia, and they're wrong. So the education does need to get out there, and that's what the Australian Cannabis Summit is all about. It's focused for doctors and patients, and to fill up your head with information and hopefully spread that information out. Yes, with the beanie.
I've noticed that the culture around treating people with medicinal marijuana generally puts the patient and the front and center, so it's all about treating them. And that's the kind of culture that's developing. And do you see any kind of chance or risk that as it becomes more mainstream and the government perhaps is more accepting of this form of treatment, that they might change the way that it's regulated, and that there's a risk of it moving away from having a patient-central focus and some other kind of...
Yeah, I think what you're talking about there is probably...
Did everyone hear that? No, could you just
So
repeat?
the question was, is there a worry about, looking at patient-focused medicine at the moment, which it definitely is, looking at each individual patient, and as we change our legislation, will that take away from that patient focus, which I think you're saying is a good thing? Yeah?
I like the patient focus. I like how the people that are actually involved in being affected, getting in there and doing it. I think it's kind of groundbreaking, and it's something that I haven't really seen much of before, and I'm really motivated.
I think that it won't, no matter what happens within the industry, whether we do have full recreational legalisation in Australia, that'll be great. There'll be a lot of people enjoying themselves and self-medicating probably very effectively, but there'll still be area for medicinal cannabis and using it medicinally and having that professional advice. So I don't think it doesn't worry my plans, and I think whichever way it moves forward, as long as we're moving forward, I'm happy with that. Yeah. Up the back there with the denim.
We spoke about dosage before and how it peaks at 2 hours and then drops to around 4 hours. If you've got pain, does the medicine continue to have an effect on you? Do you have to dose again after 4 hours?
Yeah, so that's why I'm using oils a lot. They have a long duration of action.
Did everyone hear that question?
The question was, do I need to redose after 4 hours from an inhaled dose? Generally, probably yes, and that's why inhaled cannabis, though it does give you high blood volumes, blood levels, doesn't give you an extended duration of action. So I use a lot of oils, which go 8 to 10 hours, and use them 2 to 3 times a day, and you're getting longer term coverage. So yeah, you would have to redose when you run out, basically. Yeah.
What's the best oil out of all the oils? The best type of oil, you think?
In terms of a carrier oil, I probably think Coconut oil is very good for a carrier oil, MCT. Yes.
Can I just ask, in regards to the ageing population and the drain on the medical budget, is there potential, really, of course, for a massive onslaught against big pharma based on the dollar, which is what drives our whole culture?
Yep.
I'm just curious, you know, I've got a background in nursing and sociology, and I mean, I really appreciate as an ageing person, I don't want to suck money. I'm a minimalist. I want minimal health care.
Sorry, and your question?
Sorry?
Sorry, I can't hear the question.
Sorry. So, is there not a potential push from the ageing population, palliation, quality of life, given Victoria's now got euthanasia, that something representative to push for us being able to access
That,
whole plant medicine?
yeah, for sure. That's happening right now. Every patient that comes and either comes here or goes through whichever pathway, the legal pathway, THCA pathway, every patient that comes into the population of medicinal cannabis users makes the product more effective, more cost effective. So it is a numbers game. And with the ageing population, people are asking for cannabis more, and they've tried the pills and it doesn't work. So then they've got the right to ask for it. As more people ask for it and receive it, that will bring the price down. Eventually, perhaps it'll get onto the public register of therapeutic goods, and we can access subsidised from the government, which I will do all in my power to push for. But that's once again political, and we just have to wait and see how we go with that.
So simplistically, go to your GP and say, I would like, as part of my healthcare, to be using plant medicine.
Yeah, so you go to your doctor, you say, the endones don't work, the tramadol makes my head go crazy, I've just had enough, I'm in pain all the time. What about some cannabis medicine? I know it's legal, can you access it? The problem is most GPs haven't got the time or inclination to, and that's why Plantmed is developed in my situation. And there's a few different clinics around, and they're doctors' clinics, they're just like any medical practice, so utilise them, utilise us.
So do doctors send people to you?
Yeah, I get referrals.
You're like the cannabis specialist.
If you go to your GP and say, I want a referral to Plantmed, so you go to your doctor, he may not want to do it. If he wants to do it, great, let him do it for you. If he says, oh, just can't, haven't got the time, I've only got 15-minute slots, I don't know anything about it.
Can I self-refer?
Yeah, I don't know what to do. So they just refer on, like you get referred to a bone doctor or a surgeon. You get referred to me, or Plantmed out, we've got a team of doctors there as well now because we are growing. And that's the GP referral letter. We've actually, if you ring us up or contact us at Plantmed, we've actually got referral forms which we can email to you or give you a hard copy of, and you take it to your doctor and he fills it out, puts his stamp on it, signs it, and that does the requirements for me to access cannabis for you. So that's all we need. We just need the number and the stamp and the sign, and it says, please try medicinal cannabis for this patient. Symptoms that aren't relieved, done. I think en masse that'll be happening, yeah. I think the population pressure...
There is a political movement to legalise cannabis, and it's largely due to all these people that were born in the 50s. They've now grown old.
We've got a political
That's why
party
we're
which
here.
surprised everyone getting so many votes in the election. I think that's because the word is out there.
The word is out,
It's a
yeah.
good medicine. It's coming.
Dr Teh, is your service, is there any hope that it can be bulk billed to some degree?
At
To
the
minimise cost?
At the moment, it is an out-of-pocket cost. It can be bulk billed to a degree if you're a member of the Royal Australian College of GPs, which I personally am not. I didn't train to be a GP. And you can get the Medicare rebate for a standard consult, but the time it takes to go through, for me anyway, a cannabis consult, I take an hour or so to go through the initial consult, and then it takes another 20 minutes to half an hour to complete the application process. So it's purely a time and a business model that we have to charge money to make it work.
And Just quick questions, because I'm just interested in your service. I just want to get the
Yep.
juice out of him, okay?
Yeah.
Can we do teleconferencing, or do we have to drive up to
No,
Brisbane?
you can do teleconferencing. I teleconference. All,
And I can self-refer, just get your number. I saw your pamphlets outside.
You can self-refer, contact us, pick up a pamphlet, contact us. But we do need that GP referral or a special. We need another doctor to say, please go and see Dr Teh.
Okay.
That's all we need.
Do you have a list of friendly doctors that you work with?
There is a few friendly doctors, but any doctor, it's better if your long-term GP does send the referral, because then they give me all your proper history and I can use it. If you go to someone else who doesn't know, well, it'll still work, but
And then my last question, I'm sorry, I'm just throwing them
That's
at you.
all right.
Like normally if I go to my GP and she writes me out a prescription for diazepam, say, it's up to me to then go to the pharmacy and fulfill that or not. But she does that for free. So if I get one prescription from you, is it up to me then to go to the pharmacy and fill it up myself? I'm asking you this in a vague way because if I can just collect prescriptions off you, I'll be honest, I'll just come here and just top it up a little bit or something.
You can...
Not that I want you to hear that.
No, that's fine. No, that's fine. You can get a prescription, but I can only give out technically 1 month dosage. It's considered an S8, same as
And does that cost? So now I've got my first prescription, now I want my second prescription. Am I going to be footing a big bill to just get the prescription? I don't want to go and buy it from the pharmacy, I just want the prescription.
You have to have the initial consult fee and the application fee.
No, we've done that.
Yeah. After that, and are you going to fill your prescription?
The first one I will, the second, third and fourth probably not. I'll go, not that you're going to hear this, but I'll go privately and just fill it up.
No, so you don't need one after that. So after you've got your approval, I give you your initial script. I contact the pharmacy and the supplier. They organise to send you your medicine.
Yeah.
You pick it up from the pharmacy and pay them.
So that's my first one done. Now my second, third. Are you going to charge me to get my second?
As part of my obligation, I have to follow up my patients and make sure they're all doing well. So when we do re-script fees, there is an $80 re-script fee for my clinic.
$80 a month, ongoing.
Ongoing, I work around a little bit because I'm too busy to do all this all the time. So what I do is I apply for a titration of medicine. So you may actually only use 1 mil per day, but I'll allow for titration up to 3 mils per day. So technically then I can give you your total monthly maximum dosage on your prescription, which may last you 2 to 3 months. Right. So that's the way I work around that, because I just literally haven't got time to talk to everyone every month. And once someone's set up on their cannabis medicine, I feel confident that they know how to progress with it, so I don't need to check on them. But initially, I check very closely on people to make sure everything's going well.
Right.
One more in the blue.
Hi, my name's Aaron. So I'm involved in this space, and we've been looking into DNA testing, genome testing for the endocannabinoid system. Have you had any experience in that?
I haven't, but I'm very interested in it. So if you're outside there with the co-op, is it? I'll come and talk to you after this.
DNA sequencing was the question.
All right.
I reckon we should let you get some lunch. I'll buy him some lunch. What do you reckon?
Thank you very much.
So you all should go and have a break. And remember, update